Hello, everybody. This is Aleida Castillo. It must be Monday because we are in the studio once again. This is Culturally Lit. Ooh, we're hearing feedback. We have a special guest in the studio this evening, and I'm looking forward to having this conversation because it's not a conversation that we often have. Um, we are changing gears a little bit to speak about a cultural phenomenon. So we have a special guest, Georganne. Am I saying your name correct? Yes. Georganne Chapin.
Chapin.
Chapin. Sí, mira para allá.
Está bien.
Está bien, ¿verdad? So please introduce yourself to the audience and tell them who you
Sure.
are and what you do.
Sure, I'm happy to. Thank you so much for having me on the program, Alita. My name is Georganne Chapin, and I am a healthcare executive. I have had many not-for-profit jobs and experiences. For many years, I ran a Medicaid health plan in Westchester County, a not-for-profit organization. And I'm here to talk about other work that I do, which is an organization called Intact America, which I helped to co-found in 2008. And it's an organization that works to end the practice of infant circumcision, which the United States is really the only country in the world that practices this custom almost ubiquitously among baby boys. There are other places in the world where circumcision is done as a cultural practice, a religious practice, but as far as a medical practice for absolutely no medical reason that is inflicted on baby boys, of course, without their consent, the United States is
The top.
the top.
The top.
There, Canada has certain parts of Canada it's common, and a couple of other places that have learned from the U.S., the Philippines, and South Korea, learned from the American military, but the U.S. is the only country in the world that actively promotes circumcising newborn babies simply as a matter of routine and for no medical purpose.
So we're going to get to that in a moment on what doctors tell us and what we believe as to the reason why they say that we should circumcise babies. And there's cultural differences. There's we're told health reasons. But before we go into that, I want to say you said you ran a non-for-profit health organization. And then you also are co-founded, which I didn't realize that you were co-founder of Intact America.
Right.
Both two successful organizations.
Right. And I also run the Hudson Center for Health Equity and Quality. Of course, circumcision is a glaring example of a lack of health equity to protect girls but not boys. But the Hudson Center actually focuses a lot on healthcare information technology in nonprofit organizations. So I do that also.
What's impressive to me, again, we're gonna dive in more on the circumcision topic, but this is not an easy conversation to have, and you're talking about two separate non-for-profit organizations that are very successful. How do you do that? How do you do that? I have to ask.
If you really believe something, if I've never censored myself. I always, as long as I can recall, when I first knew what circumcision was, I remember thinking, how could it be that a newborn baby, that half of all newborn babies, all boys, are born needing surgical correction? It just doesn't make any sense. Why would nature continue to put males on the planet with foreskins and only to have somebody chop them off? It just didn't make sense to me. So I'll be 70 years old at the end of this year, and in the 1970s I had graduated from college with a degree in anthropology, and I was in School of Public Health, and people were very upset because the custom in some Middle Eastern and African countries, although the U.S. was focused on Black African countries, and kind of glossing over the fact that our friends in, Saudi Arabia and Egypt and other Muslim countries were cutting girls, and everybody was horrified. And I remember saying to a group of friends of mine, well, we do that to boys. How can we judge other cultures for doing that to girls if we do it to boys? And you know how when the level of defensiveness that you encounter can tell you struck a nerve, right? So people would say, oh, nothing. One has nothing to do with the other. And then all of these, completely bogus defenses like, it's cleaner. Well, why is it cleaner? It's not cleaner. It's not clean to send your baby home with an open wound in his diaper that can get contaminated with urine and feces. And if you can raise your child, your son, to be an astronaut or to be a high school English teacher or to be a physicist, can't you teach him, or can't he figure out himself how to wash his own genitals? I mean, you don't need an instruction book for that. So those kinds of rationales were very hollow to me. And the more I learned, the more really appalled I was that this is something that we're doing to babies with for no medical purpose, and obviously without their consent. And the consent of a parent is only valid if the procedure is in medical ethics. I'm also an attorney, and I've studied bioethics and taught bioethics at the law school level. And for a parent to be able to, or a proxy, another person to be able to consent to something, for me to consent to something on your behalf, or I have to be your healthcare proxy, right? But it also has to be something that's necessary to save your life or save your health. And we have this huge exception that we make, not explicitly, but without even talking about it, for cutting part of the penis off of baby boys. Essentially, you're deciding, if you're a parent, you're going to make your baby boy's penis smaller for the rest of his life. And you're going to remove this tissue that nature or God, whoever, whatever you please, put there for a purpose. So I just, and so you asked me how I talk about it. I can't not talk about something that I see as so unjust. It's so unjust. I mean, I talk about universal health care too. I think our healthcare system is unjust. It imposes a terrible burden on everybody, actually. But if you're poor, or if you're an immigrant and you're sick, you can't get health care. That's, just plain unjust. And I think cutting a body part off of a newborn baby.
You also see it as unjust, and you see it as part of the equity or the lack thereof, right?
Right.
So
I think it's funny when people talk about more equality for girls on their organizations. There's one called Equality Now, and one of their issues, and they have good issues: child marriage, female genital cutting. I mean, these are very valid issues, but they keep talking about equality. But you want girls not to be cut, but you're okay with boys. What about equality for boys?
So when bringing up the subject, one of the things that came up is, well, we'd never heard of people really complaining about this, right?
Well,
and saying,
have.
right? So
I talked to in the 13 years since I've been working with Intact America, and in the years before when I was active in this movement, I have talked to literally thousands of men who not only complain but are devastated.
And what is the devastation? What is the complaint?
Okay, well, imagine if you grow up, right? You're a little girl and you grow up, and you have and your nipples were surgically removed, so you have these little tiny scars, and maybe your mother has the same thing, your sister, and then you meet somebody, you're in the locker room or something, and you see somebody with nipples, and you say, "What's that? It's so weird." And then somebody said, "Oh, well, you had those, but we cut them off when you were a baby." Wouldn't you be annoyed? Wouldn't you think, why did they cut off part of my body? Why didn't somebody ask me?
So that study, I think I read somewhere where it said that most men are in favor of circumcision because aesthetically it looks better, and women prefer that.
Well, in
That's not
countries
true.
that cut girls, they think that girls look better when they've been
Mm.
had their labia removed or been stitched up. I mean, that's cultural,
Mm-hmm.
purely cultural. And also, why don't you let the child make that choice? Why don't you wait till the person who you're going to cut is of an age to say, well, people in general are happy with who they are. Doesn't mean they don't have insecurities, but
Mhm.
most of us, even those of us who have a really rough life, don't want to be somebody else,
Mhm.
right?
Mhm.
And to presume that your child is going to want this alteration, this permanent alteration that you're going to impose on his body, is an invalid presumption and a violation of his autonomy.
But what about the presumption that if you wait till the child is older, that's causing more pain? It's like, it's
Well,
painful.
nobody knows the pain the baby suffers.
Mhm.
If you see a circumcision, if you see even a circumcision with anesthetic, which entails 3 injections into the base of the penis to numb it, and so maybe the baby cries for the injection but doesn't cry for the circumcision, and then he goes home with a wound, an open wound that's going to fester and hurt, that is going to cause risk of infection. So to say it doesn't hurt or the child doesn't remember is an absurd argument. If you see a circumcision, you know it hurts. It's excruciating. If you hear the baby's cries, the internet has now blocked out the sound from
Right.
circumcision videos.
So I did.
Yeah.
I searched that and I
Right.
saw the circumcision, and I didn't until I was asked, "Did you hear any sound?" And I had to look back and say, "You know what?
Yeah.
There was no sound.
It used to be, and
Just the doctors talking or whoever is doing
it's an unbearable sound to hear that baby shrieking. That comes from some place that you can't even imagine exists. So the pain is excruciating, and again, it hurts more when you're older. Well, who's that? If you make a decision to have, any kind of plastic surgery or any kind of elective surgery, you can walk into that with an expectation. You just decide to get a knee replacement. Well, you know it's going to hurt, but we don't put plastic knees in every baby because they might have to get a knee replacement later and have to go through the pain. So again, that's an argument that really just doesn't make any sense.
So should we end the practice of circumcision in hospitals?
Absolutely.
Unequivocally. It should
Yes.
be ended.
If you are, I have a friend who had a young friend of my son, who gave birth in Guyana. Her son is 10 years old. And she said it was such a relief to know I wasn't even going to be asked. She said, you couldn't get a circumcision in Guyana if you wanted when you had a baby, unless you pursued a religious circumcision and you found a moil to do a Jewish circumcision. But the hospitals don't do it. They don't have a circumstraint. They don't have the Gonco clamp. They don't have the Mogan clamp. They don't have the Plastabel. They don't do it. They simply don't do it. And have you heard that there's a terrible problem in Guyana of women not liking the men because they're not cut, or boys dying of urinary tract infections, which are supposedly more common among? No, they just don't do it. If you have a baby in Italy, nobody asks you if you're going to circumcise your son. They know you're not going to circumcise your son because they don't do it. So yes, I think it has no place in hospitals, and unless there's a serious medical problem, which is, I've only met a handful of people who said that in an infant there was a reason to circumcise an infant. Most of the problems that lead to circumcisions of, say, 2 or 3 or 4-year-olds are caused by people who just can't leave the baby's penis alone. They think they have to pull back the skin. They think they have to scrub it. They have to scrub it. Sergio and I talked to a doctor from Paraguay who said she tells her patients they have to pull it back and scrub it. I said, right. No, they don't. Leave it alone. It'll separate on its own. When it separates normally, the boy himself will enjoy washing it. You don't need to intervene. So, I have a son, he's 41, and I got seriously involved in this as a cause when he was around 18, and we were driving in the car, and he was driving. We were had been at a family event, and he looked over. He said, Mom, I never thanked you and Dad for not having me circumcised. Thank you. And it was the first time I thought of the act of circumcising a baby being something that would impact him for life. My objection to it initially was that it was painful and not necessary.
Mm-hmm.
It wasn't that it was something that would deprive a man of sensitivity, of sensation, and would create possible risks and harms. I really wasn't that aware of it. I just thought it was a foolish and unethical and painful thing to do. But I didn't really focus on the fact that men, like women, want to enjoy their full sexuality, and that includes enjoying the foreskin, which is a highly erogenous body part.
So, from what I understand and what I've heard before, it's like this foreskin is just extra skin that shouldn't be there.
Right.
And so, therefore, it should be removed.
Right. Sort of like saying your earlobe, if it's a little too long, you should trim everyone's earlobe, or if you have full lips, you really ought to reduce them. One of my nieces has very long toes, like her father. You're going to cut the toes off to the first joint because her toes are too long. What's too long? What's too much skin? So the fact is, I can tell you the anatomy, right, of the foreskin. I can go into that.
Sure.
Right? So the fact is that the foreskin is a double-layered organ. It's part of the penis, but it is double-layered, and it's unique tissue in that the outside is normal exterior skin, and the inside of it is mucosal membrane. So the inside of it is moist and highly sensitive, and it is attached in almost all newborn boys, probably 99%. The foreskin is attached to the head of the penis, and it protects the glands of the penis, the head of the penis, and it protects the opening from contamination. And then, as a boy grows, as a boy matures, and ultimately, almost always by the end of adolescence, the hormones of puberty will loosen that foreskin, and it becomes a gliding organ that a boy can pull back and forth. It keeps, in men who are circumcised, the head of the penis, the glans, Glans, a lot of people call it a gland. It's not, it's the glans. In men who are circumcised, the glans becomes grayish and dry over time. In a baby who's recently circumcised, it's red and bloody. And that as that heals, it keratinizes. It becomes essentially callous and dry and insensitive.
And so that's what causes the losing of the sensitivity then, right?
Right. The foreskin protects the head of the penis and keeps it moist and sensitive. So in an intact man, the glands of the penis remains pink and moist throughout life. So it's sort of like saying, what would the inside of our mouth be if we removed our lips? The lips are what allows you to close your mouth, right?
Mm-hmm.
And if you had no lips, your mouth would be perpetually open, and your tongue would become dry, and the inside of your mouth would become dry. Well, that's if you removed your eyelids, similarly, your eyes would dry out. So the foreskin provides that sensitive, erogenous, and lubricating function, which in sexual intercourse is important for masturbation and for pleasuring oneself, your man. And in sexual intercourse, it gives that gliding motion for both parties. Now, the original reason for circumcising in the U.S. and Britain, which Britain has stopped, was 19th century, in 19th century Victorian England, masturbation was considered to be a terrible risk to a man's or boy's health. It was spilling sperm without procreation was considered to be debilitating and even the cause of mental illness. So circumcising a boy, and it was first inflicted on boys 12, 13, 14, was considered a way of stopping them from masturbating. Now, it doesn't work.
Right.
Most men will masturbate.
Yeah.
Most people masturbate. But then as medical specialties evolved, as obstetrics evolved and women started having their babies in hospitals, circumcision became sort of a fad that was justified by a series of different reasons. And they started doing it to babies.
Right. And you mentioned that
babies can't run away, by the way.
Right. But doctors say that it's, cleaner, it's healthier to be circumcised, it's better for the child in the long run. We're going to go to a commercial break. When we come back, we're going to talk about the cultural differences and beliefs in this practice and in the Latino community, which it doesn't happen as often. We'll be right back. This is Aleida Castillo. You're listening to Culturally Lit on WVOX 1460 on the AM dial. So you're still live on Facebook. We can still keep talking.
How are we doing?
We're doing good.
I think, can we go back to that question that doctors say?
Yes.
Yeah,
Yes.
Yes.
Yeah, because that's really what you're saying. What you're saying is in complete contradiction of what I've heard. But more than that you hear that, you just hear it, and then you take it for granted that could be any different, and it is what it is. So that to say, you're essentially saying it's healthier
to be intact.
Absolutely. Sure. And the argument is that it's not healthier to be intact.
There's no evidence on that, right? Like there's absolutely no evidence. There's no epidemiological evidence that shows that countries or even states or populations that don't circumcise their boys are any healthier. The U.S. is 48th or something in health status. I mean, our men should be like, we shouldn't have any problems if that were true. It's simply not true. And now the doctors have retreated. The American Academy of Pediatrics does not recommend it. They say there are advantages, but they're not adequate to recommend it for every boy. Well, which boys do you want to recommend it for? So they don't recommend it anymore. What they do is they say now they've done a switch-o, and now it's parents want it, the parents requested, and that's why we did our survey. That it's not necessary, but we do it because the parents want it. Which, of course, if the parents want, you're not supposed to give a kid antibiotics if the parents want it, unless they have an infection, right? So you have to protect the child. The child is the patient in this case. The child is getting the surgery, right? You can't do to a child whatever the mother or father. If the father has take Ghana, take scarification, Nigeria, where people are scarified, right? An African person from an African country that practiced scarification can't take the child to an American doctor or anyone and say, I want him or her to have these scars on his face. So they will do it. So why should you be able to scar the baby's penis? Right?
So, there's really so much. You really can't cover everything in 1 hour, right?
Right.
There's so many angles and so many different perspectives, right? There's and we'll talk about it when we go back on the air. Aren't the doctors supposed to know better? I mean, who is behind the movement for it to remain in the hospitals? Aren't the doctors? We trust doctors
Well, we don't
for the
so
most
much,
part.
right?
Yeah.
It's a lot of mistrust now. We know there have been things that doctors have done that are not in people's interest. I mean, they used to do routine tonsillectomies. They used to do routine hysterectomies on women. You know,
Right.
Yeah. I mean, there are many, 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 and there are people now who don't.
We're going back on. All right. Are we back? There we go. Thank you, everybody, for listening. This is Aleida Castillo. You're listening to Culturally Lit on WVOX 1460 on the AM dial and online on Facebook at Culturally Lit. We have Georganne, boss lady, very impressed with your, as someone who has worked a lot in the community, and I know how difficult it is to start a business or even start a non-for-profit. At the very minimum, it's impressive to see the levels to which you have reached with both causes in health. This topic is a very sensitive topic, the circumcision and whether or not to circumcise boys. And as before coming onto the show, I tried to have the conversation. It's safe to say that some people just don't want to have it. Right. And when I think back, going to the hospital and how, or, I mean, there's really much discussion about it.
Right.
It's almost just, so people do it. So how do if doctors say to you that it's the safest way and the best thing for your child and the cleanest and healthiest thing for your child, how do you choose no?
Well, that is a dilemma, isn't it? When somebody, the conversations don't take place very thoroughly before the baby is born, and the pressure to circumcise a boy is on, often prenatally. So the obstetrician will have the mother fill out a consent form, and the consent forms all say it's not medically necessary. They all say that. And they don't even say the benefits or cleanliness. They say what the risks are, and they say it's not medically necessary.
So why the consent form?
Well, you have to
consent.
Have a consent form to do surgery, right?
Right. Yeah.
But the American Academy of Pediatrics and other organizations that sort of follow them on children's issues have really switched over the last decade. And they don't say it's necessary anymore. They don't even say it's desirable. They say it's a cultural practice,
yes,
and it should be up to the parents. And then when confronted, the doctors say, well, I can't tell you, Aleida, how many doctors have said to me, well, it's the parents who want it. The parents want it. So Intact America, one of the things we do, and by the way, your listeners can look at intactamerica.org. That's our main website. We also have a website called circumcisiondebate.org, and we have Facebook pages, Intact America on Facebook and Circumcision Debate on Facebook. So if you look at our websites, you can see the kind of work that we do. But one thing we did in response to all of this claim that it's the parents who want it, because we hear from parents every day who say, when I got to the hospital, I was subjected to intense pressure. I was asked 5 times. I was asked 12 times. When I said no, they tried to talk me into it. When I woke up, they were taking my baby away. And I said, where are you going? And they said, oh, it's time for his circumcision. They're asking mothers to sign consent forms when the mothers are essentially drugged or sleepy after hours of labor and delivery. They're asking the mother to sign a consent form in the delivery room when the baby has scarcely emerged from the womb.
When it's something that should have been discussed long before you get to this point.
Or not discussed at all because we don't do it, right?
Right.
I mean, when people say we have to, do your research, like in these other countries where they don't circumcise, they don't do research. They just know it's not necessary. They don't do it, right? So So yes, it should have been brought up, and there should not be pressure ever to do a medically unnecessary procedure. And you shouldn't be doing a medically unnecessary procedure on a baby that's going to impact that baby for his entire life, right? So now the doctors claim it's the parents. So Intact America conducted a survey in 2020 asking mothers who had given birth to boys in the past, I believe it was 2 or 3 years, whether they had been asked or solicited to circumcise their sons. And we found out that 94% of mothers had been asked, and the average number of asks was 8 times. 8 times whether they wanted to circumcise their child. Now, if you say, if you're in a McDonald's and somebody says, "Would you like fries with that?" and you say, "No, thank you," and they say, "Are you sure you wouldn't like fries with that?" Everybody eats
Gets fries.
Our fries are great. And you say, "No, that's okay, really." And then you go to pay and they say, "Should we add on the cost of the fries?" And you say, "No, thank you." They say, "People are so happy with our fries." Now, I'm only up to 4, right?
Mm-hmm.
These people are being asked 8 times whether they want to circumcise their sons. So the pressure, so that, and Latino women were asked on an average more than white women, and Black women were asked on an average more, which speaks to the kind of cultural presupposition that brown babies are somehow more in need of this culturally important and cleansing surgery than white babies. So everybody gets asked. But the pressure on immigrant children, immigrant parents, and on Black parents is even greater. So it's a lie that parents want it. Parents, we asked the question also, if you had not been asked, would you have brought up the topic of circumcision? And we found, and in the mid 40s, around 45% of women said yes, they would have brought it up. Well, that's because it's culturally imposed. But between the 45% who would have said something anyway, according to them, and the 75% who circumcised their sons, that gap of 30, right? That was the pressure that was imposed on them.
So you have, and I want to talk about the Latino families, immigrant families. Are they being pressured more to have their child circumcised because the assumption is that they're not going to do it? Or what is the assumption? Why is it that it's imposed more?
It's because they say no the first time and then they just keep pressuring them, right? And a lot, we also know that, and we know this about all kinds of healthcare procedures, that a non-English speaking person in the healthcare system is a tremendous disadvantage. Mm-hmm. And we have found that even English speaking people really don't know what circumcision entails. If they saw a circumcision procedure on a video, mm-hmm. and if they heard that baby scream, they would not subject their child to it, right? Most moms would not subject their child to it. But Latin women, I shouldn't say that, Spanish-speaking women who don't speak English are even at a greater disadvantage. And they've never seen, a lot of them, a circumcised man. So they hear, do you want to circumcise your son? That's what we do here. It's easy to see why somebody would they're not going to say if they don't understand the language. Could you please explain the procedure to me and tell me exactly why it's necessary? They just had a baby. They're being told by a doctor, this is a thing we do here.
You're told that it's the right thing to do for your child.
You don't need to say that. Mm-hmm. It's just implied, right? You're in a hospital, we're taking care of you, we want to do this thing to your son.
So who's behind this movement to do it? Because if doctors, quote unquote, know best, and they're giving you advice on what's healthier for you, and so, there's so many procedures that I guess that you can push for in hospitals. If you're talking about that hospitals are for-profit organizations, which that's a whole nother topic on whether
they're for profit or not for profit, they're into revenue generation. And
but there's so many procedures they can
medicine
do.
is a fee-for-service, is based on
Fee for
fee-for-service.
service.
Right. So every circumcision carries a fee, and it carries a doctor's fee, and it carries a fee for the hospital, and there's medical equipment that gets purchased, and there are the molds that the baby gets put into and strapped down into called a circumstraint. There are all the clamps, scalpels, all the disposable bandages, and all of those things. And then there are many complications and accidents that need to be repaired. And we calculate that it is about a $2 billion industry in the United States.
$2 billion.
Yeah, about $2 billion, right? So it's an industry. But there's something deeper. I mean, it's too simple to say it's just a moneymaker, because you'll meet doctors that say, oh, I don't really make any money off of it. I just do it because the parents want it. I'm skeptical of that because they get money. I've also had doctors tell me I put my 3 kids through college on circumcisions.
Wow.
Right? I lease my new car every year from circumcisions. I've had doctors say that to me at medical conventions.
So it's a business more so than you're trying to impose healthy or raise healthy babies. It's both.
Yeah.
So when we come back, we're going to talk about Intact America, its mission. And gosh, there's so much here. We have some comments we want to read online. Come back. This is Aleida Castillo, Culturally Lit with Georganne and Intact America.
You're getting comments online?
Yes. So we're gonna read them while we have online. We have, in my experience, working in a city hospital, it's about 50-50.
Nobody's called me. Has anyone called me an anti-Semite yet?
No.
Okay.
We want to talk about that and talk about culturally.
My predecessors in this movement, I've never gotten a death threat. I've gotten menacing calls, but I've never gotten a death threat. But the person who was really one of the earliest people who started the movement, she's had death threats.
Wow.
And our office is, I don't feel it's necessary right now, but when we set it up, it was anonymous. It was in a building. We didn't have signs up, and we get all our mail in the P.O. box. I don't worry about that anymore.
So we have, this is a great topic. Love her presentation of the facts. Hysterectomies, especially on the controversy that it happened in the Black community, immoral. I had an experience where I was having side effects from psychiatric medication. About half the doctors I saw, including mental hospitals, their knee-jerk reaction was to increase the dose. I've never known fear like that. These are professionals who take an oath to help others. Haunts me to this day. Thank God for GPs. One big takeaway is that other countries don't do routine medical circumcision. So, Intact America, foreskin for sale.
Yeah. Oh, that's the other thing. Foreskins get sold for biotech purposes, for artificial skin, and also for cosmetics. Facials. There was a big to-do recently because Ellen DeGeneres had Sandra Bullock on, and Sandra Bullock was talking about this facial that she got, and Ellen kind of pressed her to talk about what it was, and it was a facial that she'd gotten made out of Korean babies, cells from Korean babies' foreskins.
Wow, I did not know this.
Yeah.
So, so we want to talk about culturally, because it's like, okay, so Intact America's mission is to end this practice in hospitals, but you're not saying that if the Jewish, for example, if they believe in this and they want to do it, you're okay if
I'm not okay with
you're
it.
not okay with it.
No.
So you're
but I'm not. That's 99 and something percent of the circumcisions that take place in the U.S. Even Jews get their babies circumcised in hospitals without boils. Lots of them,
Mm-hmm.
So Jews make up 2% of the population. Mm-hmm. So, and they have a lower birth rate. So actual religious circumcisions are few and far between. But so we don't go around to synagogues and tell them to stop circumcising their babies. Mm-hmm. We're talking the bulk of the circumcisions, the 99% that are taking place in U.S. hospitals. So it's not like I think it's okay to cut your baby because you believe that God spoke to Abraham. Mm-hmm. But that's not where our energies are placed.
Mm-hmm.
Our
Mm-hmm.
energies are placed on, pseudo medical circumcision that the American medical industrial complex inflicts on baby boys. There's nothing about a Jewish baby that doesn't require the same protection. We want to protect all children. Right?
Yeah, and I think we want to talk when we get back on air. We want to talk about that. There are Jewish families who don't circumcise.
Right.
Mm-hmm. And so you also mentioned that there's a conversation about whether the child can be part of the religious ceremonies if they're not circumcised.
That's kind of a big topic. That's almost like a separate topic.
I think that
maybe we could do
another
that.
show.
Right. I'd be happy to.
Yeah.
And I'd be happy to get you another person, a Jewish person.
That would be good. All right. It is Monday. I was going to say it's Wednesday, but it's not. Culturally Lit Wednesdays from Africa, Mondays from New York. We are in WVOX studios with Georganne from Intact America. We are talking about the movement and the mission to end circumcision in America. And before we went on a break, we were talking about how the doctors and how basically the push to have parents do it. And so it's done by both financial gain and what?
And status quo. It's very powerful. Most American male doctors are of an age where they are probably circumcised. Everyone's complicit in this, right? If you are circumcised, you have a big investment in believing that it's okay, and believing it's normal. Now, I talk to people all day, every day, who don't think it's okay that they were circumcised, but there are plenty of people still defending it. If you've circumcised a child yourself, if you have either with your own hands, if you're a doctor, or if you have two older sons who are circumcised, it's a horrifying thing to realize that what you did was a lifelong decision for somebody else, and you really didn't have the right to make that decision. So that's why it's so difficult for people. Now we talk about the pressure, financial pressure, and also I'm mentioning the status quo. The other thing we should probably mention, and maybe you want to do something about this another time, but foreskins are also big business. So particularly large academic medical centers. Community hospitals throw the foreskins in the garbage. This thing that's so important to cut off gets thrown in the garbage. Big academic medical centers send the foreskins to pathology labs, and then we haven't been able to figure out exactly how the transfer takes place, but biotech firms buy foreskins and use the elements, the fibroblasts, to make either skin replacement, artificial skin, or cosmetics. So there are cosmetics on the market that if you look at the label, it will say fibroblasts, and that's from infant foreskins.
Wow.
So and let me just, say the obvious, which is the baby didn't get paid for his foreskin, right? That's called tissue piracy, right? Mm-hmm. Taking tissue from someone who did not consent to having that tissue commercialized or sold. There's the term for that, and by the way, is tissue piracy. If you found out that your kidney was removed and it got sold to somebody else, you thought you were removing it because it was diseased.
Right.
You found out it got sold to somebody else, I don't think you'd be happy.
So the parents are not told that the skin is not for sale.
They might be told that it could be used for research purposes, and we've never seen a consent form that says it could be commercially sold. But again, the parent is not the owner of that foreskin. The parent doesn't own the baby. The parent can't sell the baby's body parts. They can't sell the baby's kidney or a chunk of the baby's liver or one of the baby's eyes. So they can't sell the baby's foreskin either.
This is just a fascinating topic. And I think about how contentious, for example, abortion is, and that the pro-choice, and that if you don't have pro-choice or you ban it altogether, you're going to have people having abortions in their garage, kind of thing. With this, I would imagine if there's no hospital where you can go and get circumcised, you're going to have people at home doing it. No?
Our experience is no. I mean, you'll still have some religious circumcisions, but most people are not going to. Well, they get arrested too. If you take a knife to your son's penis, you a layperson. That's what's so absurd about this. Even if you do an okay job at it, you get arrested. You get arrested for abuse. You can't. You as a layperson cannot cut a body part off of another person. You can't do it to your daughter. You can't do it to your son. You can't reduce the size of your daughter's clitoris. But a doctor can, and a doctor can cut off your son's foreskin.
And now culturally, I mean, the Jewish faith, this is a practice. I mean, what would they do then if it's banned from hospitals? They just do it at home.
Well, they don't. A Jewish circumcision has no validity if it's done by a doctor in a hospital on the first day or the second day after birth. The only ritual circumcision for Jews that has any meaning has to be conducted with ritual, right? So you bring in a mohel and you have all, it's a religious ritual, and it takes place almost always on the 8th day after birth. So to oppose medical circumcision, hospital-based circumcision, which is 99% of the circumcisions taking place in the U.S., really doesn't have anything to do with religious circumcision. That said, we believe that all children should be safe from having their medically unnecessary surgeries carried out on their body, whether you say it's for a religious purpose or not. It's still a surgery.
It's still a surgery,
right? But it's really important to emphasize that circumcision is not an American religious practice. It is an American medical procedure, and an illegitimate one at that, because it doesn't serve any medical purpose. It's simply a custom that is being legitimized because somebody in a white coat is doing it.
So, and there's a comment on Facebook that a growing number of Jews now hold Brit Shalom for their sons, in which the child makes a commitment to God without any circumcision.
Correct. There are organizations, there are many Jews in the movement, and there's an organization that your listeners can look up, Beyond the Bris is one. There's a new organization called Bruchim, which is about inclusion and making sure that Jews who do not circumcise their children can find synagogues where they are welcome in Jewish practices. So yes, Brit Shalom is more and more common as people have naming ceremonies, and Brit Shalom means peaceful. A peaceful welcoming ceremony.
So perhaps in another show, when you come back, we can talk about that, and we could have someone who practices the Jewish faith, who believes in not being circumcised,
and not cutting their child. And they believe that a boy can decide. I mean, there are Jewish men all over the world who are not circumcised for either because of their country of birth, it's not practiced there, or because their parents just didn't do it. And they are every range of religiosity.
We have a caller on the line. Caller, state your name, where you're calling from. Hi, Steve.
Lovingly Jewish, but very much modern for what that's worth. I think this discussion is very interesting. I came in midway, so I'm not claiming to know everything the guest said, but I want to thank you as host for, I think, being awfully independent in asking questions. I think the questions have to be asked, and you did it. I would just say that the prohibition that the guest seems to endorse is just a very disturbing idea to me. I think many backgrounded people practice the bris or circumcision. It's apparently a large number of male births that are so handled in this country, and it's become customary or otherwise. I certainly don't think it should be a law, but I don't think it should be prohibited.
Excuse me, Steve, thank you so much for your really thoughtful comments. You might want to take a look at intactamerica.org. That's our website. And, we're very clear. I didn't use the word prohibition. I said I thought hospitals should just stop doing it because has no place in American medicine. We're not advocating for a legal ban on circumcision. We're hoping that people will see the light and that doctors will quit doing it over time. So I just want to clarify that.
I understand. I appreciate it. I did say I didn't listen to the whole broadcast, but I would say, you've handled it sensitively, and again, the questioning and answering have been fair. I would just say, though, however, that in the wrong type of climate, and I'm not imputing this to you, guest, it's only that I think in today's environment, discouragement and avid advocacy often leads to prohibition. It just seems to be the climate we're in today. But I'll certainly look at your website.
Thank you so much.
All right. Thank you, Steve, for calling. We'd love to have you call back next time we have this topic. Thank you, everybody else, for listening and tuning in. And we'll have Georgette and Intact America once again so we can continue the conversation. This is Aleida Castillo, and you're listening to Culturally Lit. Georganne.
Georgette was my mother-in-law.
Georganne, thank you so much for coming on the show.